Hello, welcome to the Total Joint Education presentation that will discuss preparations that need to be made before having total joint surgery. It's important to consider the post-operative phase prior to surgery. This includes ensuring your home is ready to minimize unnecessary obstacles as you recover. To begin, let's consider your post-operative sleeping arrangements. If you have a bedroom on the second floor, is there a place downstairs that you'll be able to sleep so that you don't have to climb up steps those first few days after surgery? If so, you may want to consider sleeping on the first floor for a short period. Next, you'll want to consider your hallways and walking areas in the home. The walkers OrthoIndy uses are typically 24 inches wide, so you'll need to ensure you have enough space to safely move around your home with a walker. If you have items that are frequently used that are typically stored high or low to the ground, you may want to consider moving those items to a countertop level. This will prevent you from having to stand on a step stool on your tiptoes or bending low to the ground to reach necessary items. Also, please be careful when sitting down in a chair. You should ensure that the chair does not have wheels and use the armrests to assist with sitting. You may need to use additional pillows for comfort and support while sitting. You may want to consider using a shower chair in the early portion of your recovery if you don't have a walk-in shower. For showering purposes, it may be beneficial to use a long-handled sponge or shower brush to assist with washing your body after surgery. Please keep in mind that you won't be able to shower for a few days post-operatively, but once you're allowed to shower, these items may make your bathing experience a little easier. If you have pets, you may want to make arrangements in advance to assist with their care while you recover. This could include a friend or family member or local boarding facility keeping your pet in the first few days of recovery. If your pet remains in the home, you'll want to be careful when walking near them, as you don't want to trip on them and you don't want them to jump on you while you're in recovery. And finally, you may want to have a friend or family member stay or stop by your home initially for the first few days to ensure all is going well and you don't need any additional assistance. As part of your recovery, you will need a walker. During your hospital stay, you'll be provided a walker as part of your recovery. You can also borrow one from a family member or friend. If you choose to borrow one, please bring it to the hospital for our physical therapist to evaluate the walker to ensure your safety. The walker on the bottom right is not acceptable. These walkers do not allow you to stand up completely and could be a fall risk if attempting to sit in the seat. Please do not bring these walkers to the hospital or use during your recovery period. We also suggest that you consider if a basket on the walker could be a helpful addition. The basket can help with moving items to and from a location so that you can properly hold on to the walker for safety purposes. On the day of surgery, you'll need to bring some important items to the hospital. Please bring all medications with you on the day of surgery in the original containers. If you have a CPAP machine, we would like for you to bring yours to the hospital if you're staying overnight. It's also very important that you bring your insurance cards and a photo identification card. If you have a living will or power of attorney paperwork, we do advise that you bring those items in with you to the hospital. However, these documents are not required as part of the registration process. We strongly encourage that you do not bring any money, jewelry, or valuables with you while you're here at the hospital. As part of your surgery preparations, you'll be asked to bathe with chlorohexidine gluconate, commonly called Hibiclens. The purpose of this solution is to help prevent infections. You can purchase this at any major pharmacy. You'll find the details of how to complete this bath by looking in your Total Joint booklet. The night before your surgery, do not eat, drink, or smoke after midnight. Please remove your makeup, your nail polish, and all jewelry and removable piercings. The morning of your procedure, you'll take any medications that your provider instructed you to take the morning of surgery. Please take medication with as little water as possible. Please make sure you arrive as you are instructed. Your arrival time will likely be 2 hours prior to your surgical procedure. It's important for you to arrive early so that our nursing team can prepare you for your procedure. Your provider's office will contact you with your arrival time. On the day of surgery, you will meet an anesthesiologist to verify your medical history. Once that process is complete, you will transition to the operating room for your surgery. Your surgery, on average, will take anywhere from 45 minutes to 2 hours. Once surgery is complete, then you will move to the recovery room. The purpose of the recovery room is to ensure that you safely wake from anesthesia and are tolerating the procedure well. So each person's time in the recovery room will vary. The recovery process includes ensuring your oxygen levels are sufficient, that you're awake and able to follow instructions, and your pain is tolerable. The nurses will make sure your vital signs are in an acceptable range, that your dressing is intact, and that you're able to take deep breaths and cough. During your time in the recovery room, your family and friends will need to remain in the waiting room. Safety is our top priority. While you're here in our hospital, you must always call the nursing staff before getting out of bed. We also have emergency call cords in each bathroom. When you get up, you will have a gait belt in place until physical therapy says you're safe to be up on your own. Should you have any questions or concerns as you go through this process, please ask the care team. We're happy to help. Pain management is an important part of your recovery process. You've had surgery, so it's expected that you have some pain, but the goal is to keep the pain manageable. Your oral pain medication will take roughly 30 minutes to start working. Your pain medication schedule will be ordered by your provider. It's helpful to take your pain medication with some food to help prevent an upset stomach. Pain management will also include additional methods that are not pharmacological to help assist with pain management. This will likely include resting, ice, elevating your leg, and relaxation and diversion techniques. Do not have your foot on the floor for more than 1 hour at a time for that first week after surgery. The longer it's down, the more swelling you're going to have, so keep it elevated as much as possible. One of the biggest side effects of narcotics is constipation. It may be necessary to take a stool softener to prevent constipation while taking pain medication. It is recommended that you have some at home for after surgery. You can also help prevent constipation by eating more fiber, fresh fruits, fresh vegetables, and whole grains. Complications can arise from having surgery, so it's important for you to be aware of the complications that can occur after surgery. The first possible complication that we will cover is related to infection. Your care team has put some intervention in place to prevent infection. Some of the ways we help reduce the likelihood of complications are administering antibiotics at the time of surgery, encouraging good nutrition, managing blood sugar levels, encouraging patients to stop using all nicotine products for at least up to 6 weeks after surgery, and frequent hand hygiene, such as washing and hand alcohol gel. Hand hygiene is the easiest way to prevent infections. We encourage you to speak up if you don't see someone wash their hands. Another possible complication is the development of a blood clot in your body. Please review the Preparing for Surgery guide to see the list of blood clot symptoms. Your providers employ interventions such as ankle pump exercises, the application of pneumatic compression devices, administering blood-thinning medications, and ordering the application of TED hose to prevent blood clots. Please note, you may not have all interventions as a part of your treatment. Ankle pump exercises should be done 10 times each hour for each ankle. Pneumatic compression devices should be used at the frequency prescribed. If you're prescribed blood-thinning medications, please take as directed for the indicated amount of time. TED hose should be worn for 23 hours out of the day. All of these interventions are designed to lessen your risk of developing a blood clot. You can get blood clots in the legs or lungs. Please make sure you contact your surgeon if your leg becomes red, warm, and/or swollen. Please contact 911 if you develop sudden chest pain or shortness of breath. Please contact your surgeon with any concerns that include incision redness, fever, increased drainage, and uncontrolled pain. If you have questions or concerns, please reach out to the physician's office. Thank you for choosing OrthoIndy Hospital for your joint replacement needs. If you have questions about this education or your procedure, please contact OrthoIndy. We're happy to help.